Priory Group, the leading independent mental health care provider, supported the Charities Depression Alliance and Radar to carry out research to explore whether linking health policy with policy on disability employment and inclusion might help reduce job loss, long-term economic inactivity and isolation for those living with depression. The subsequent report was launched at the House of Commons at an event supported by Norman Lamb MP.
I thought it was quite bizarre that the World Health Organization said that depression is the second biggest cause of disability in the world, and yet there was no discourse going on between the worlds of disability and the worlds of mental health. So I wanted to bring together these two great organisations, Depression Alliance and Radar, and I wanted them to talk about what it meant for depression to be a disability and how to prevent the disabling effects of depression.
The thing about this report is that for so long depression and other mental health services have worked in isolation. They work around mental health and within the sort of mental health improvement service. But what this report has done is it's taken a different angle. It's actually really worked with a disability charity, and to bring those two worlds together is really interesting and really new. And we're challenging something that has remained a stigma within a stigma, really. Stigma of mental health, the stigma of depression, and then beyond that the stigma of disability, that people didn't even really want to put the two things together. So what we're saying is depression does have a very disabling effect. When you experience depression, you can lose your employment, or you might not get started on the job that you want to do. Really, it prevents you from getting into the sort of full opportunities, being able to access the full opportunities that you should be entitled to. So what we're doing with this report is actually putting the two worlds together and saying, we know there's stuff out there that is happening already, it's on the ground, but people with depression are not fully accessing it. And that we know that the employers and people with physical disability haven't actually thought about where depression comes into their world as well.
So many people with depression haven't been getting the support they need, particularly with employment and with the whole of their lives. People may get the immediate treatment, the medical treatment or cognitive behavioural therapy, which is great, but people also need real practical peer support and support to get and keep work. And the disability programmes haven't really served people with depression well enough, and nor has primary care got involved enough with employment. So it's about really bringing two worlds together, the disability world, which has got programmes for people to help them with work, and the depression world, which obviously is supportive of people but hasn't always attended to that wider issue of people's lives, their work, their livelihoods. And we think by joining forces we can be much more powerful, bigger reach to people and better solutions.